Hi guys, hope you're doing good. Okay, so this is Dr. Srikanth from team Mdsconquer. So now in this video, I'm going to talk about your plan for the subject dental histology from 2024 batch point of view. So hope most of you have started the journey recently or about to start your journey with this subject as the first. So let's talk dental histology in detail from examination point of view. The first thing I want to add to the histology is a closed subject. Is a closed subject. Closed subject means the mode of preparation in the round 1 or in the round 2 or probably in the next rounds, that is 3 and 4 before you go for the final exam, will be almost same. Means nothing new added. Okay, for example, what your seniors has prepared, you are going to prepare in the same pattern. What I have prepared during my preparation is almost the same that you have to prepare, because histology doesn't have major modifications or major changes. Such subjects which doesn't have so much of modifications or so much of updated content or so much of things which may be clinically correlated, I categorize such subjects as closed subjects. So such closed subjects from my point of view, I'll be listing general anatomy, I'll be listing oral anatomy, I'll be listing oral histology, that is nothing but called as dental histology. So these subjects are closed subjects where how many times you read, the mode of preparation will be almost same. Maybe first time you will take some more, you will have some lengthy preparations, but as you progress to the second round and third round, you are going to smash this subject hardly in 1 or 2 days. If you can handle these subjects in 1 or 2 days in the next upcoming rounds, then only you can handle or give time for other subjects which really requires time, which are mostly clinically correlated. So such subject is called as your histology, which is a closed subject. So coming to the blueprints, okay. So if you talk about Neet MDS, okay, dental histology, dental anatomy together is going to carry 14 marks, and I want to keep histology 7 to 9 marks. Okay, 7 marks according to the blueprint, but histology can be correlated to many other subjects. Like for example, you take conservative. Okay, you take conservative. So conservative, in conservative dentistry, okay, we basically talk about enamel, we basically talk about dentin. Okay, we basically talk about enamel and dentin. And if you jump into endodontics, okay, we'll talk about pulp in detail. We'll be talking about each and every histological aspect of the pulp also. Jumping into perio, we'll talk about all the periodontium, which includes your alveolar bone, which includes your gingiva, which includes your cementum, which includes your PDL, and all these, including alveolar mucosa, is also being discussed there. Okay, so all these are going to be getting integrated. So my content is like your dental histology will get integrated to these subjects, that is conservative dentistry, endodontics, and perio. So keeping that in mind, your score will ranges from 7 to 10. So all the basics of conservative, endo, and perio may be correlated to dental histology in most of the scenarios. So the score is going to be 7 to 8. And I'm coming to INICET. Okay, so INICET, the score varies. Okay, sometimes we have 5 to 7 questions. Sometimes we have 7 to 9. Sometimes less than 5 are also seen related to dental histology exclusively. So the mode of preparation has to be given a decent time because it has a decent weightage in your NEET examination. The next important thing what I want to focus on is how to handle this subject. Okay, so I have given a schedule. So before going deep into the schedule, okay, so just give a brief glance. I mean, like we want to prepare a checklist, and I'll tell you in which sequence you have to proceed with the checklist. Okay, right. So this is a rough plan for your dental histology. Okay, right. So coming to 31st and January 1st, I want you to cover development of teeth. Okay, so I'll be telling what to be done, everything, don't worry. So followed by, I want you to finish enamel. Okay, on 2nd and 3rd Jan, I want you to go ahead with the dentin and pulp. Okay, and followed by 4th, I want you to focus more on periodontal aspects, that is your cementum, periodontal ligament, And fifth, alveolar bone and maxillary sinus. Maxillary sinus, yes, of course, in your general anatomy, again your maxillary sinus will be covered. Coming to 6th Jan, I want you to focus on salivary glands, oral mucosa. Again, salivary glands will be covered in general anatomy too. Maxillary sinus in general anatomy too, temporomandibular joint in general anatomy too, and most of the pathological aspects of these temporomandibular joint, maxillary sinus and salivary glands are related to your oral path and oral medicine, and the treatment aspects will be discussed in your general, in your general as well as in your oral surgery. So as of now, we'll be dealing more inclined towards the histology part, because most of you are taking this as a first subject in proceeding your preparations. Then 7th January, it will be tooth eruption and shedding, and followed by 8th, we'll be talking about histological stains, the different types of stains, methodology, how these specimens will be done by oral pathologists and everything. This particular topic is being ignored in many standard MCQ books. I don't know why, but recently in the last few years, paper setters are so interested. Like for example, you see the latest question paper, Neet 2022, you have 1 or 2 questions on this particular area. Very short zone, area of very less importance, area not being focused, but it is important. For example, if you take a person, oral pathologist into consideration, what an oral pathologist is going to do is this. It's not the outcome, it is the process by which they are going to fix the slides. What are the materials they are going to use, what is the cleaning material they are going to use, what are the fixing materials they are going to use. So definitely it's a very important area, and you are having questions on these areas. Okay, but my point is, standard MCQ books, which most of the students are reading, are missing this area. This is important. So go back. I want you to have a quick glance. So I'll provide you the content and I want you to solve. Similarly, I want you to focus more on slides. Okay, so many standard MCQ books, okay, what most of us are being exposed, they are not color books. Point number 1, they are not color books. So they don't give much diagrams. Okay, and coming to histology, what is the word of histology? Histological specimens, histological stains means whatever you read in histology will be or should be correlated to a diagram. For example, you talk about development and growth of a teeth, in which you have stages. Everyone knows we used to draw those stages during our initial phases of the BDS in the DADH labs, right? That you have to read and correlate with the diagrams, because they can ask you diagram based questions, and of course diagram based questions on histology both in INICET as well as Neet are very common and familiar. Okay, so what books are missing? You have to focus, you have to read them, and you have to be fit in the preparation. Followed by, I have given 2 days for the revision, and followed by 11th, you are going to give an examination on dental histology for 120 marks. So let's try to keep things simple, okay? Things simple and easy in the initial phases of preparation. So once we attain speed, then we will try to go ahead with a higher speed, okay? So don't be too aggressive in the preparation in the initial phase, because you are still in the initial phase. So initial phase, you have to start slow, then you have to slowly increase the pace. Then once you feel like you are on track and you are on track with the preparation, then I want you to be aggressive. Because in the last few years, I have seen many students, particularly the young generation, who are very aggressive in the preparation in the initial phase. 1-2 months so aggressive, covering the things, but after which they take a break. So I don't want that to happen to you. Start slow, understand the process, what is happening, try to interact with the mentor, try to open up with your doubts, confusions, and the mode of preparation. So mentors are going to help you out in reading the content exactly. So there is something called as process of reading the content, means how you read, how you approach or how you start reading an MCQ based content is totally different, like how you handle your theory exams until now. So the drift of theory based exams to an MCQ based exam is totally different, because a theory based exam is something they are going to ask you a question. Okay, write about write about the histology or histology of your enamel, or write about a particular junctions, the types of enamels, with draw a diagram. So in this type of question, you can write whatever you want related to that particular content. But the problem here is when an MCQ is asked in the same area, and you will have an options like A, B, C, D here, and you need to pick a right option. A B means you have to pick only B, then only you will get +4 in Neet. If you by mistake has hit D, it's slightly confused in the examination. Instead of getting +4, you'll get -1. So accuracy, like you should be very, very clear with what you are reading, and you should revise that n number of times. Now here you no need to break your head to recap the content what you are going to read on a white paper. Like for example, you no need to write anything on a white paper, a blank white paper. No need to draw any diagrams. Here you need to identify a diagram among the 4 options. Here you need to identify the right answer among the 4 options. There you have to write multiple things. Okay, that is easy. But problem is you should have so much of memory. Here memory is required, but accuracy in the memory is more required. So the drift is very important. So understand this process of drifting from your theory based preparation to an MCQ based preparation. Similarly, theory based, when I'm talking about theory based exam, okay, theory based exam doesn't require a long term memory. Means tomorrow is your dental histology exam. What you do today or 2 days, you are going to read vigorously, cover the syllabus, try to understand everything, try to remember the headings, and you are going to go and clear the exam. But an MCQ based exam will have all the subjects. That's the most difficult aspect in MCQ based exam. DA theory based means only DA. DH theory based only DH. But coming to MCQ based exam, you will have all 25 subjects from the first BDS to that of the final BDS. So here what is going to happen? There is something called as short term memory and something called as long term memory. So you need to convert your short term memory to long term memory. For example, you are reading a topic, development of teeth, today you are going to read. So that will be in the short term memory. So again after a few days, within 5 days, you have to revise development of teeth again. The revision has to be done. That is the reason why I dropped some time for revision. So once you revise, that short term memory will be converted to a long term memory, and this process is very, very required for an entrance examinations where you need to handle multiple subjects and multiple topics. So this is not the same scenario as we are dealing with the theory exams until now. For example, tomorrow you have a DH Viva. Today you read something 1 or 2 hours, go just try to recap what you have done to the external. But this is not. Today you are reading DH. I may keep one more examination probably after 1 month or 2 months from now on DH in combination with some other subject. So you should have a habit of converting this short-term memory to long-term memory, so that this memory is going to stay for a longer duration of time in your little brain. Okay, right. I hope like you're converting this short term to long term. Okay, we'll discuss this particular topic, which is very, very important in the upcoming classes. So next one, I want you to prepare a checklist. Okay, this is an open. Okay, so this is an open. Conquer has entered into the 9th batch. So you're the 9th batch students of Mdsconquer. So we have a checklist. Okay, a pre-formulated checklist will be given, and I'll try to monitor you. Okay, the PDFs of how to mark this checklist and how to proceed, how to prepare your own checklist will be posted on your respective groups. Okay, so take a printout. Please try to stick on to the checklist and make sure once you are done with everything on the checklist, keep a tick mark. And please try to save this particular print on your respective books, or maybe on your MCQ book or anywhere. But make sure that this space has to be retrieved once you are dealing with the same subject second time. So I'll be talking more about checklist. So I'm not going to break your heads. Okay. So textbook reading is mandatory for DH. My answer is no. I don't want you to read textbook. I want you to refer textbook. Reading is a different word, and referring is a different word. Okay. So whenever you have a doubt, whenever you are not clear, I want you to go back and refer. I want you to go back and refer the textbook. Okay. I don't want you to read the textbook. Reading textbook is I mean, like, it may be important, as most of the mentors, they may stress, but you are an Mdsconquer student. If you are an Mdsconquer student, reading textbook properly is already done by the mentors over here. So I don't want you to read Okay, because I'm already done with the reading phase, because I'll tell you what is important from the examination point of view and what is important from an MCQ point of view, and I'll force you to read. Okay, but I don't want you to read and waste time. I'm going to read, I'm going to help you and make you the stuff simple for you. So referring is important, not reading. And for example, if you're referring also, make sure you try to stick on to only one textbook. Okay, so there are two standard textbooks for this particular subject. One is Orban's and second one is 10 kids. Okay, so I mean, like, I don't want to fight which is more standard here. My logic is very simple. Like, I feel like most of you have read Orban's in your round 1, okay, during your BDS level, and I hope like most of you have the textbook. So I strongly recommend to go with the textbook what you have referred when you have done your dental histology at a BDS level. So refer that book. First book is what book you have read. Okay, so okay, or your wish, any of these two books can be, any of the book can be done. Okay, that is completely your wish, either Orban's or Tenicates. Please referring, this is only for referring, not for reading, only for referring, not for reading. So coming to the reference book for DH, you can keep any of these books, but coming to the content based, okay, so I'll be talking about the content based. So I want you to have a proper reading of synopsis. So before you start any topic, okay, so any topic, the first thing you have to do is you have to see the smart video. So smart videos of every topic will be available on your website. Okay, smart video. So first thing before you start any topic, please try to finish the smart video, and please try to add a small notes, because this is your initial phase, means adaptive phase. I don't want you to write big notes, or maybe in the later half of the preparation I don't want you to write notes. It's okay, not required. But as your initial phase, because you require a focused based reading, you require a preparation where your short term memory has to be converted to long term memory. So this process require preparation of notes in the initial phase. So now start preparing notes. Nothing wrong, please do prepare notes, because your initial phase, I have given so much of time and so many hours of preparation for dental histology, because logically from my point of view, a good student can complete dental histology in just 3 days, because this is a minor subject, this is a closed subject, but I have given you so much of time because I am allowing you through the process of understanding the preparation, of reading the content from an MCQ point of view. So first I want you to cover smart video for every topic, for every day. Start with smart video. Second important thing I want to stress you is synopsis. So this synopsis, I want you to pick either power play books. You have power play books, right? So either power play book synopsis, okay, or any MCQ book synopsis. Okay, most of you may read Dental Pulse or Dentist. Okay, any MCQ based, like for example, you're reading Dental Pulse. So if you don't have PP books with you, because few people, they have started the preparation. Okay, if you don't have PP books with you, you can start with Dental Pulse synopsis of that particular topic of that particular day. If you have both, read PP books first, followed by Dental Pulse, you read it. So I mean, like the main thing you have to analyze over here is, once you're done with a smart video and you know a concept, if the concept is repeated in the PP books, try to skip it. Read, understand, move fast. If you know something, move fast. For example, you're traveling on the same road from past 5 years. For example, you're going to college from the past 5 years, interns. Okay, you go to college from the past 4 years, and now as an intern also, you're going in the same road on your two-wheeler. So how you, because once you're coming to a new place, so you'll take some time, but once you're traveling on the same road from past 5 years, we'll go fast, because we know where the turning is, we know where the traffic signal is, we know where the crowd will be more, we know where the road is bad and we have to be very, very careful. We know everything. Okay, so we can go fast. Similarly, once you find a similar topic in the smart video that is being repeated in your power play books or your Dental Pulse, make sure you try to move fast. Topics which are unknown, go slow, understand. Topics which are known, go fast. Right. So followed by, once you're done with that, I want you to move to the number 3, that is your solving MCQs. Okay. So problem here is, there are few people reading MCQs. Synopsis reading has to be done. MCQ solving has to be done. Okay, so once you have an MCQ, don't read the MCQ. Keep on, okay. Which of the following is correct related to this particular pathology? Option A, B, C, D. Answer is C. Explanation is this. This is called as reading. Solving means understanding the question, trying to come out with the answer and knowing the right answer. If you are going for a wrong answer, know the right answer and know where you are going wrong in thinking. That is called as solving. Solving is different, reading is different. Okay, see, I want to tell you in a simple way. Doing a clinical case is different. Seeing a clinical case is different. Means, for example, your for your endo PG is doing an anterior root canal. You are an assistant and you are seeing what he is doing. That is called as reading. Coming to solving an MCQ is you yourself doing a case is called as solving an MCQ. So there is a very drastic difference, right? Doing a root canal therapy is so much different from watching a root canal therapy that is being done by someone. Okay, so please try to understand the difference between these two things. So please solve the MCQs. Don't read the MCQs. Read the explanation, read the synopsis, understand the solving of MCQs. So that is more important. Followed by step 4, I want you to attend the evening activity. So evening activity is a landmark that we have started in the field of dentistry throughout the country. First time we have started these activities. Okay, and we don't want to leave the basics at any cost, like where we have started, we don't want to leave. Okay, so every day we will take an activity of 40 minutes just to activate you, motivate you, and we'll most probably meet in the evening at 6:30, and we'll be talking to each other for like half an hour or 40 minutes on the respect to apps, or on the respect to WhatsApp. Okay, so we'll be having some activity. Okay, so evening activity, please try to attend. If something new is being discussed, if some diagram based questions are being discussed, or if some subject is being discussed which is unknown to you, please try to shift to that your notes. And followed by the next 2 days means for example, development of teeth exam has to be given on the 3rd day, not on the same day. Don't give exams on the same day, because if you are giving exams on the same day, 100% sure that you will go for a right answer. So I don't want you to give exams on the same day. I want you to give exams on the 3rd day. So exam has to be given on the 3rd day. So every topic what I have listed here will have an exam. Means dentin will have an exam, pulp will have an exam, cementum will have an exam, periodontal ligament will have an exam. So please try to give those exams on the next day, so that you will know where you are lagging in the memory based things, where you are lagging in the concepts, and you can come out, rectify them, add to your notes, and this is how you have to progress deep into the preparation. So this is a rough outline, okay, so of your preparation checklists, of your preparation schedule, and the few concepts like how to transfer yourself in this mode of reading will be done on a daily basis, and how to convert your short-term memory to long-term memory, which is required for an MCQ solving, or which is required for an entrance examinations like Neet MDS or INICET MDS, will be discussed on a daily basis. Okay, stay positive, stay blessed, and start the preparation with the positive note. You are always open, free to talk with the mentors, because the mode of preparation can be moved from one level to other level by increasing your confidence and hoping for more success. This is going to happen only once you talk with the mentor. This is guided based preparation. Means you are going to have a mentor. You're going to have a mentor who is going to respond, talk with you. Okay, and probably this is going to be handled by group of 2 or 3 mentors. Of course, you have a subject specific mentor, but the integrity of preparation, okay, the integrity means the borderline of the preparation, the finishing and polishing of your preparation will be done by core 2 to 3 mentors only. Means the rest of the mentors, they come, they build their increment. So each mentor is going to come, they give the concepts and build the increment. So those are called as incremental building of your restorative material. But the integrity within the cavity, or polishing, finishing and polishing, and all these are done by the core mentor. So I am Dr. Srikanth, okay, the lead founder and the head of Mdsconquer, who is going to be with you 24/7, all 365 days in your upcoming preparation phase. So most of you are going to give examination on 2024 March. So we have a decent time of almost like 14 months, which is very, very great time to do some magics in your life of dentistry. Okay, stay positive, stay blessed. I'm always open for you. You can call me, ping me, interact with me at any time. So that's all from my side. All the best, stay positive. So please do make a note of my number. This is my personal number, so you can just call me or you can just drop me a message on the WhatsApp, so I'll be responding whenever I have time. So my number is 9989427971. Make a note. Mdsconquer will be there as a backbone for your preparation. All the best. Stay positive. Bye. Take care. Signing off, Dr. Srikanth from Team Mdsconquer.